Hello, everyone, and welcome to another episode of Arthritis at Home. Today, I'm joined by Ellen Wang, who is a PhD student at UBC and also programs coordinator at Arthritis Consumer Experts. Ellen, welcome.
Thank you so much for having me, Kelly.
You're part of the ACE team, along with myself and a couple of other team members who attended the latest Canadian Rheumatology Association and Arthritis Health Professional Association's annual scientific meeting. This year it was held in Quebec City in February. And it was actually the 9th consecutive year that we, ACE, hosted something that we call the CRA Arthritis Facebook and Twitter live event at the CRA meeting. And during that program at the meeting, we interview as many of the leading rheumatologists, researchers, patient organization representatives, physiotherapists, occupational therapists, and other arthritis health professionals who are attending and presenting at this meeting. So it's a gathering every year of some of the smartest leading people from our arthritis community. And our opportunity running this program is to meet with them to give us a sense of the research that they're presenting and try to translate in a way that you, our audience, can understand. And as part of that effort, beyond the CRA Arthritis program itself, we thought we would devote an episode to some of the highlights that we learned about during the meeting. Ellen, you're going to walk us through some of these highlights, and you were actually one of those smart people who were presenting at the conference as well. So I'm really happy that you're able to do this and not me, and try and do some knowledge translation around some really exciting research that was shared in Quebec City. So I'm going to turn it over to you and hope that you can provide us some of these highlights.
Absolutely. And Kelly, always an honor. And truly, I do want to say it was an absolute privilege to be there. It was, I would believe, was my first in-person Canadian conference, and to have the privilege to speak to all of those great minds and all of, I would say, the individuals who are so passionate about arthritis care, about arthritis advocacy. You could tell that, as soon as you walked in, it was very much so close, tight-knit group of individuals who were just there to support each other, there to learn more. And I think the beautiful thing about going to a conference is, I think, really just having your eyes opened about what different people are doing across the country, whether that is in research, that is in advocacy, that is in dissemination or learning to share information. So one of the kind of really exciting things from one of our partners, the Canadian Spondylitis Association, they recently rebranded and relaunched their new website. I had the pleasure of interviewing Jeff Beach, the former president of the SPA, and we had a really beautiful dialogue around the role of patients in advocacy organizations and how it is really important and ways we can get knowledge into the hands of our end users or of those patients. And, I would highly, very much so, encourage everyone to check out the new SPA website. They do have a tool there to help with decision-making in terms of medications. So all arthritis medications, it helps you weigh the risks and the benefits, and something you can print out and take to your physician. So really exciting developments. You can see that advocacy and research are going hand in hand, and there's organizations like the SPA, the Spondylitis Association, that are, really leading the way. And I also have got the chance to interview Aisha. Aisha Beg is a nurse clinician. So that means she's not only a healthcare provider herself, she's a researcher herself, but she's also a patient, and her journey is so, I think, so touching, but also so reflective of what many people go through when it comes to a delayed or even a misdiagnosis. And I don't mean like it was misdiagnosed for a year or so, like a decade. And to hear that story really reminds us all of why we do this work, of why it is also, as a patient, it is so important for you to gain the skills of advocacy for yourself. So self-advocacy, because unfortunately, we do live in a system and we operate in a system where you have to speak up for yourself if you don't believe you're being heard. So highly recommend everyone check out both of those interviews. Really, really impactful for myself as a trainee, but more so, I would say, as a person, as a human, and as a patient myself.
On the topic of patients first and patient-centered perspectives and experiences, that during the 9 years that we've had the CRA arthritis program, it's been powered by ACE, but it's been supported by representatives from the Arthritis Patient Advisory Board of Arthritis Research Canada. So again, getting patients involved from that body, who we work closely with on a lot of other projects, but they've been very, very supportive through the years as well.
Yeah, and it's really nice to see so many advocacy organizations coming together to support one another, so many researchers coming together to celebrate each other when they win an award. So it really was a phenomenal experience. And then the second thing I wanted to highlight, I had this beautiful interview with Dr. Michelle Batiche, who's an associate professor of pediatrics at McMaster University. And her work is dedicated to supporting youth to transition to adult care. So she runs a specialized transition clinic where individuals or patients with, for example, JIA or juvenile idiopathic arthritis move at that age of 18 from pediatric care, where there are, I don't want to say more resources, but there is more resources and more support to a system where it's a lot of, you have to be the person, you are the primary caregiver. And as an adult with inflammatory arthritis, you are your own primary caregiver in learning how to schedule appointments, to be on time at those appointments, to self-monitor between appointments is something we need to learn and develop. And I think that is the problem she's tackling, because youth are going through a huge transition stage of their life period. And then they have to also transition how they care for themselves. And her team are doing some fantastic work. Would highly recommend you check out that episode. And they also have a really cool app with a bunch of questionnaires that you can do, very accessible. And it really does help with that self-monitoring piece. Self-monitoring simply means you provide your feedback, you write notes, you answer certain questions. So when you go to your care provider, that you are prepared. So highly.
Yeah, and fundamentally, just to make sure people understand that those people who are transitioning from pediatric to adult care are switching key members of their healthcare team, including their rheumatologist.
Thank you, Kelly. That's exactly it, where I did mention. So when someone transitions from pediatric to adult care, you actually transition rheumatologists. So it's not that the same rheumatologists follow you throughout. And this beautiful system that has been put in by Dr. Batiche is where the adult rheumatologist will actually attend sessions, attend appointments with the pediatric rheumatologist and the patient. So we're starting to create that bond, that trust at an earlier stage. And the last piece, as somebody who will be going to physical therapy or go through my physical therapy training, Miss Laura Paslint, who's a clinician researcher with the Schroeder Arthritis Institute at the University Health Network, leads what is called the Advanced Clinician Practitioner in Arthritis Care. We call this the ACPAC or the ACPAC program. And essentially, it is an advanced training program for individuals who are already occupational therapists or physical therapists, or I believe nurse practitioners as well, to develop the specialized skills to work with individuals with arthritis. So it really is that specialization that we've all been looking for, to just have a deeper understanding of perhaps the needs, the wants, the preferences of some of the individuals with arthritis, and to have that disease specific knowledge, like so key. And for those who may be listening who are interested, we will also provide a link of how you could, access or learn more about the program in case you're interested in taking it at some point.
You're also one of those people who was carrying a poster and presented it during the poster session. So I think we're missing maybe the most important piece of research, and that was the one that you presented on behalf of ACE. Can you tell us about that?
Yes, Kelly, absolutely. I'm so grateful to have had the opportunity to do work with ACE, where, I do want to thank everyone who completes our surveys. Like, truly, this is your work. This is your work being highlighted at the moment. This is your time that you've dedicated. I had the pleasure of looking at the data, but this is, what you have contributed to, and you should take ownership of this. But in essence, the title of the poster was Inequities in Arthritis Care in Canada. So what we had done is we ran a survey to look at access to interactions with healthcare providers and some of the different care practices in arthritis care. And when we looked at the data by dissecting it between women and men, individuals of color, so Black, Indigenous, and people of color, what we call BIPOC, and white, we saw truly astounding differences. And if you look further at rural and non-rural, you would be absolutely blown away by some of those differences, whether it was, for example, if you were a person of color and you lived in a rural area, your ability to access care. We would know instinctively, right? You could guess that it's probably a little bit harder to access care, right? But it's the degree in which someone experiences difficulties. It truly blew my mind to think about how many barriers these individuals that fall at that intersection of being rural, living in a rural area, as well as being a person or a minority or an individual who is underserved, in this case, would experience. So if we can't reach care, if we have poor experiences with care providers, of course we don't want to come back. If our worries and our thoughts are dismissed, or we get spoken to in a tone that's not very gracious and not very welcoming and a little bit condescending, that isn't good care, because dare I argue that part of care is that interaction that you have with the care provider. If that's toxic, then it doesn't matter if your healthcare provider prescribes the right medication to you. It really doesn't matter at that point, because that interaction itself was so toxic. So we were able to really dig into the data and look at some of the intersections. And yeah, what we found was really interesting. Not only because the numbers were wow, but because it came to realize, like, these were real people living in Canada. So it's not just like, oh, I'm looking at some numbers of people who I will never get to talk to in my life, and it doesn't matter, this is another country. It's like, no, this could be my next door neighbor. They could be one of these data points that, I'm looking at or trying to understand. This could be somebody I pass in my clinic. Perhaps they had to drive 4 hours to come to a rheumatologist, but I don't know. And that was like the impact it had on me. I was like, wow, these are real people that live in Canada.
I think what was encouraging is that ACE's poster that you presented was one of several that looked at health inequities in Canada. So it's a conversation that patient groups aren't only having, but clinicians are, arthritis health professionals are. And I think there's a real opportunity for the community collectively to start not just examining these gaps, these disparities, but to start addressing them. And I think we had some very, very constructive discussions, conversations during the meeting. And I know following up, we are going to be meeting and speaking to a lot of people. And just a reminder as well, as it relates specifically to Indigenous care, ACE is helping lead the community towards a path of truth and reconciliation, and you can find information about that on our website. Now, if people want to find more information about the research that we highlighted, it was not only aired live during the conference on Arthritis Broadcast Network, and just a reminder to our audience, if you're not familiar with the ABN, it's Canada's largest patient-led arthritis news outlet. So if you're looking for the latest arthritis news or patient education, we encourage you to go to our broadcast site at Arthritis Broadcast Network. But there's some other places where they can find this information as well. Ellen, maybe you can share some of those locations with us.
Yeah, thank you, Kelly. Absolutely. So if you are interested in learning more, to actually see some of these recordings, they're very short and sweet, about 10 to 20 minutes, very digestible, and they are with the absolute leading experts in Canada. We will refer you, or we'll link below this video, links to, we have YouTube for the complete playlist. We also have Twitter and Facebook for some of the posts that we made as well.
Great. Well, thank you very much for spending some time with us today, Ellen, and sharing this important news and information and updates that we were able to provide from the CRA annual meeting. And also a reminder to our audience that ACE will be closely following the research presented at the upcoming EULAR conference in Europe. And we will be able to provide you an update and some key takeaways from that conference in June, when it occurs in this year. I think it's in Milan, Italy. So looking forward to seeing you again. Thanks for joining us on Arthritis at Home. Have a good day.
Thank you, everyone. Goodbye.